we're talking about movement here, looks a little bit simple, but each kind of movement, the relationship with the joints and the relationship with the muscles there, and even tendons there, and the bone there. So all of these structure in there and keep the joints movement. So that's basically the shoulder joints we can do mostly of the movement. Is the big movement of the joints. So another movement we're talking about circumduction. Circumduction. So circumduction, the movement, just like a picture here. So still some of the joints, is not all the joints we can do this kind of movement. Truly, our shoulder joints can do this kind of movement. Yeah. So like a movement, like a circle. And our hip joints, we can do this kind of movement. So that look like a combination, some other movement together and make a 360 degree, that kind of movement. So that's some basically kind of movement way we try to remember. Certainly some detail and some books, they may have more way to movement, but that's just the general movement way. So picture here are still more explanations for different kind of movement. Yeah, the same thing. We're talking about the flexion for the height, go to this way, and the extension height, recover to the middle line here, and if more bending backward, that belongs to hyperextension. So that's just these three kind of movement is a pretty close relationship here. And the same thing for the shoulder joints. Moving this way, flexion, moving back, extension, up to here. More back, yeah, more back, that's a hyperextension. Yeah, that's hyperextension. So moving to here. That's for the shoulder joints. And for the elbow joints, yeah, for the elbow joints. So elbow joints for most people, yeah, for most people, only have flexion, like a small angle here, and extension, yeah. Most go to up to like 180 degree here. For some people, truly they possible do some hyper extension here, but not for everybody. Not for everybody. Still normal. Yeah, still normal. And for the wrist joints, yeah, wrist joints, we do flexion means go to this way, and the extension come back, and more go to those side of the hand. That means hyperextension. So that's for wrist joints. And for the hip joints, Yeah, hip joints. Flexion this way. Extension, coming back. Remember, coming back, go to 180 degrees. It's more coming back. It's more coming back. We need thinking about like these knee joints not bending there. Yeah, we're talking about hip joints here, not the knee joints. Certainly, knee joints bending there is belong to knee joints flexion. But if we're thinking about hip joints here, that means hyperextension. Yeah, hyperextension. So from here to here. And for knee joints, yeah, for knee joints. So that's flexion. And go back extension. Knee joints, so basically we couldn't do hyperextension because we have tiny small bone here. Yeah. It's limited. So each of the joints, what kind of movement they can do is depending their structures, depending their bones, depending their muscles and the tendons, how connected each other, like we see the videos. They gave us more detail from the videos. Then the movement, lateral flexion, and that's from the middle line and then bending to side, that's easily. And still for the shoulder joints here, yeah, still for the shoulder joints here. Go to center, adduction, and go back, abduction, yeah, abduction. That's basically, and the same thing for the hand, yeah, go to center, adduction, yeah, go to center, adduction, and go back, abduction. Yeah, they talk about not finger here, they talk about the waist joints here. So waist joints, they talk about the angle here. Yeah, it's a little bit confusing for this picture here. So that means moving this way is more go to center or more close here, adduction, and moving this way, more abduction. Legs more clearly. Yeah, legs more clearly. Go to center, abduction, adduction, and go moving away, abduction. And the finger here, more go to center, adduction, away from the center, abduction. So similar like before. And circumductions, sometimes people also call the rotation. That's sometimes. Just make a circle, that's for different joints. Yeah, basically for shoulder joints and the hip joints. Yeah. So make a circle. So that's basically our limb part, the muscles movement. Then we go to a special part, the muscle movement for the eyeballs. So basically, each side of the eyes, we have 3 pairs of the muscles. These 3 pairs of the muscles control all of our eyeballs, the movement. So that's our eyeballs movement by the muscles on the eyes. So like these eyes, This eyes is our right side eyes. People face to us. Yeah, that's the right side. That's the middle part. Yeah, middle part. That's the side part. The side part. So we say we have three pairs here. That's the one pair muscles. It control the eyeball movement, go to center, yeah, go to middle, and go to side. Another pair of the muscles, that's upward and the lower part, control the moving up and down. Certainly, which side muscles contractions, they will moving the eyeball to which side. And then you can see we have another two muscles. They are touching to the eyeball here. So basically, these two muscles is control the eyeball turning, yeah, kind of turning. It's not like before, we only can move in this way, or maybe upward, down. Now we combination these two muscles, we can move in the eyeball everywhere. So that's about our muscles can move in the eyeballs.